A blood pressure reading can look perfectly normal on the monitor and still be too low for the person sitting in front of it. That may sound surprising, especially after years of hearing that lower blood pressure is always better. But once you reach your 60s, 70s, or 80s, blood pressure becomes more complicated than simply aiming for one ideal number. Let me be clear from the beginning. High blood pressure remains a serious health concern. Over time, uncontrolled hypertension can damage the arteries, heart, brain, kidneys, and eyes. It can increase the risk of stroke, heart attack, heart failure, and kidney disease, but treating blood pressure safely is not about forcing the number as low as possible. It is about protecting your organs without making you dizzy, weak, confused, or unsteady on your feet. For many older adults, that balance is where the real conversation needs to begin. As we age, the arteries naturally become stiffer and less elastic. When you are younger, healthy blood vessels expand as the heart pumps and then relax between beats. This flexibility helps blood move smoothly through the body and allows your circulation to respond quickly when your position or activity changes. As the arteries stiffen, the heart must work harder to move blood forward. This is one reason the top number in a blood pressure reading, known as systolic pressure, often rises with age. At the same time, the body may become slower at making the rapid adjustments needed to keep enough blood flowing to the brain. Think about what happens when you stand up. Gravity immediately pulls some of your blood toward your legs and lower abdomen. Your body must respond within seconds by tightening the blood vessels and slightly increasing the heart rate. These changes help maintain blood flow to the brain. When that response is delayed or inadequate, blood pressure can fall after standing. This is called orthostatic hypotension, or postural hypotension. You may have experienced it without knowing its name. Perhaps you stood up from the sofa and your vision became dark for a moment. Maybe you stepped out of a hot shower and suddenly needed to hold onto the wall. You may feel lightheaded when getting out of bed, weak after standing at the kitchen counter, or unsteady when rising from a chair. These symptoms are sometimes dismissed as a normal consequence of getting older. But repeated dizziness when standing should not simply be ignored. In a younger person, a brief moment of lightheadedness may pass without consequence. In an older adult, especially someone with reduced balance, weaker muscles, poor vision, osteoporosis, or a history of falls, that same moment can be dangerous. A fall may result in a fractured wrist, a broken hip, a head injury, hospitalization, or months of rehabilitation. For some people, a single serious fall can permanently change their ability to live independently. This is why the safest blood pressure target cannot always be determined by age or by one seated reading alone. Let me give you a practical example. Imagine two patients who are both 75 years old. Both have a blood pressure reading of approximately 142/88. The first patient remains active. She walks most mornings, tends to her garden, prepares her own meals, and manages her daily activities without assistance. She has no history of dizziness, fainting, or falls. Her kidney function is stable, and she tolerates her blood pressure medication without difficulty. For this person, carefully lowering an elevated blood pressure may provide important long-term protection. Better blood pressure control may reduce stress on the heart, lower the risk of stroke, and help protect the kidneys and blood vessels. Now consider another patient of the same age with the same reading. This patient has become physically frail. He has lost weight, takes several medications, struggles with balance, and feels dizzy whenever he stands. He recently fell while walking to the bathroom at night. The number on the blood pressure monitor is the same, but the situation is entirely different. For this second patient, simply adding more medication without investigating the dizziness could create additional risk. The clinician needs to understand what is happening when he stands, whether he is dehydrated, whether his medication doses overlap, whether he is eating enough, and whether another medical condition is affecting his circulation. The lesson is not that the second patient should leave high blood pressure untreated. The lesson is that the treatment must be adapted to the person. This is where many people become confused about the number 120/80. That number is widely recognized as a healthy blood pressure, but it is not a mandatory target for every older adult in every situation. A reading that is safe and comfortable for one person may cause weakness or dizziness in someone else, especially if their pressure falls significantly when they stand. For many adults, healthcare professionals may recommend a blood pressure target below 130/80 when that goal can be reached safely. Strong blood pressure control can offer meaningful cardiovascular protection, and age alone is not a reason to accept dangerously high readings. However, treatment decisions should also consider your overall health, kidney function, heart history, diabetes status, medication burden, physical strength, cognitive function, fall risk, and the presence of symptoms. A healthy and active 70-year-old may respond very differently to treatment than a frail 85-year-old who becomes unsteady every time medication is intensified. Instead of asking, "What should the blood pressure of every 70-year-old be?" it is more useful to ask, "What blood pressure gives this person protection without making daily life unsafe?" Your symptoms are an important part of that answer. If you repeatedly feel dizzy, weak, foggy, or unstable after standing, tell your healthcare provider. Also mention blurred vision, unexplained fatigue, near fainting, confusion, or falls that seem to occur after getting out of bed or rising from a chair. Do not assume that your blood pressure medication is definitely responsible. Dizziness can have many causes, including dehydration, anemia, low blood sugar, heart rhythm problems, inner ear disorders, infections, or neurological conditions, but the symptoms deserve to be evaluated. A clinician may check your blood pressure in more than one position. A typical assessment may begin after you have rested quietly while lying down. Your blood pressure and pulse are measured before standing, then checked again after you stand, often at approximately 1 minute and again within 3 minutes. A sustained decrease of at least 20 points in systolic pressure, the top number, or at least 10 points in diastolic pressure, the bottom number, may indicate orthostatic hypotension. However, the reading is only one part of the assessment. Your symptoms, heart rate, hydration level, medication schedule, and medical history must also be considered. Some people choose to record their readings at home. This can be useful when it is done carefully. Use a validated upper arm monitor and make sure the cuff fits correctly. Sit quietly before taking the first measurement. Keep your feet flat on the floor, support your arm at heart level, and avoid talking during the reading. Record the result, the time of day, your pulse, when you took your medication, and how you felt. If you also measure after standing, make safety your priority. Do not attempt this alone if you have fainted, fallen, or felt severely unsteady. Have someone nearby and stand next to a stable chair, countertop, or other secure surface. Stop immediately if you feel that you may collapse. Bring your readings to your healthcare appointment. A written record collected over several days can reveal patterns that may not appear during a single office visit. Perhaps your pressure is highest in the morning. Maybe it becomes low after taking a certain medication. It may fall after a hot shower, a large meal, physical activity, or a period of poor fluid intake. These details can help your clinician make a more informed decision. What you should not do is change your treatment on your own. Do not skip a dose because of one low reading. Do not cut your tablets in half, change the time of your medication, or stop taking it without speaking to the clinician who prescribed it. Sudden changes can cause blood pressure to rise sharply and may increase the risk of serious cardiovascular problems. Instead, ask your healthcare provider whether your standing blood pressure has been checked. Ask whether any of your medications could be contributing to dizziness. Ask whether the dose, timing, or combination of medicines should be reviewed. And remember that blood pressure drugs are not the only medications that can cause lightheadedness or balance problems. Certain prostate medications, diuretics, sleeping pills, sedatives, antidepressants, and other drugs may affect blood pressure, alertness, or stability. Taking several medications together can increase these effects. That is why a complete medication review is so important. Bring a current list of everything you take, including vitamins, herbal products, pain relievers, and supplements. Many people assume that a natural product cannot interfere with prescription medication. Unfortunately, that is not always true. Some supplements may lower blood pressure, affect blood clotting, or interact with medication used for the heart, kidneys, or diabetes. Combining several blood pressure lowering products can cause an unexpected drop. Never use a supplement as a replacement for prescribed treatment without medical supervision. Daily habits also matter. Regular physical activity, a balanced diet, appropriate weight management, adequate sleep, reduced excess sodium, and limited alcohol can support healthier blood pressure. Strength and balance exercises may also help reduce fall risk. Adequate hydration can be important for some people who experience postural symptoms, but increasing fluid or salt is not safe for everyone. People with heart failure, kidney disease, or certain other conditions may need specific restrictions. This is another reason the plan must be individualized. There are also moments when dizziness should never be managed at home. Seek urgent medical attention if dizziness occurs with chest pain, severe shortness of breath, fainting, sudden confusion, difficulty speaking, facial drooping, weakness or numbness on one side of the body, a severe new headache, or a head injury after a fall. These symptoms may indicate a medical emergency. The goal of blood pressure treatment after 60 is not to chase the lowest possible number. The goal is to protect the heart, brain, kidneys, and blood vessels while helping you remain steady, alert, active, and independent. A number on a monitor is important, but it never tells the entire story. Your standing pressure matters. Your symptoms matter. Your medications matter. Your strength, balance, and medical history matter. The safest blood pressure target is not simply the number that looks best on paper. It is the level that provides meaningful protection while allowing you to live your daily life safely. That is the conversation every older adult deserves to have with their healthcare provider.